Hello. How are you doing today? Doing all right? Good. Good. That's what I like to hear. I'm doing all right myself. Thank you very much for asking. Well, today's video, don't think it's late, because it's addressing a subject that is only a few days ago, and although only a few days have gone by, a lot has happened. But generally speaking, it's a good idea that when you address a matter that is of some seriousness, to take a while for the evidence to come in and then offer feedback or opinion or analysis or insight. It doesn't happen all that well on social networks. On social networks, action and reaction happen very quickly. And that is the norm. How often have you seen that someone posts something on Twitter and if that account has a lot of following, the followers have taken a good amount of time to actually look into what has been said and then offer some reasoned viewpoint. It doesn't happen normally. And those who withhold a response will do so on the basis of consideration, which is good, depending on the seriousness of the subject at hand. Well, this subject is serious, obviously, but there's no need to get overly excited about it. We can take a calm look at what has transpired and where we are now. So originally, on October the 8th, via Twitter, which is a very commonly used social networking platform, Joseph A. Ladapo, MD, PhD, the Surgeon General of Florida, shared guidance. He said in the tweet, "Today we released an analysis on COVID-19 mRNA vaccines the public needs to be aware of. This analysis showed an increased risk of cardiac-related death among men 18 through 39. Florida will not be silent on the truth." Well, just looking at the words here in the tweet, which I believe the Surgeon General would have given some thought to before posting it, because of his reach and responsibility. The words, "the truth," don't appear in scientific journals. I haven't, in thousands and thousands of documents, ever seen a group of scientists claiming to have found the truth. Now, even though we are at a stage in the developments of the sciences where we know a lot of things with a great amount of certainty, it simply is not a practice to use the phrase "the truth." That gives some insight into the thinking of the man and the people to whom these words appeal to. The truth is something beyond which there should be no further conclusion. If you have the truth, that's the end of the matter. If you walk into a room, and after you walk into the room, you see one man pull out a gun and shoot the other, and the other man collapses and dies, if somebody asks you who pulled the trigger, and they're just 3 feet apart, instantly you could say, this man pulled the trigger, and that man collapsed and died. There are no windows. There's one door. You walked in. You saw this happen. And you know. Do you want to investigate that? Sure, go ahead. But if somebody asks you, what is the truth? With a very high level of certainty, you could say, this is the truth. That's when it's quite appropriate to use the words, the truth. Is that the level of certainty Mr. Ladapo has as Florida's Surgeon General? Well, if in his mind he had that level of certainty, how does he feel now? We will go over some evidence. But before we do, on October the 10th, he no longer used the word or the phrase, the truth. He said, I love the discussion that we've stimulated. Isn't it great when we discuss science transparently instead of trying to cancel one another? I'm going to respond to the more substantive critiques. And he did so in a thread. Mind you, the original tweet was, for a while, taken down by Twitter, and then it was restored. So that became an issue, and people were getting so excited about the fact that, the Surgeon General's tweet was taken down by Twitter. What a grave injustice. And when it was restored, well, discussions continued to happen, feedback continued to come in. And Mr. Ladapo at the very end says something. Finally, is it really hard to imagine that mRNA COVID-19 vaccines that increase myocarditis in young men by 10 times, 20 times, or 30 times, see Karlstad et al., JAMA Cardiology 2022, also increase the risk of cardiac death in that age group? Of course it's not, and we all know that. So, from claiming to speak the truth, he has moved on to conjecture, and he has cited a reputable journal. And of course, anybody can look into that journal, and high-quality scientists have done that. Now, we're going to approach this matter from the viewpoint of news articles. And because I'll be citing certain news articles doesn't mean I endorse them as a source from top to bottom. We're just looking at a few citations from those sources. But yes, those sources, as news sources, do go through the process of verification before they publish something. So let's take a look at a few of those. Well, let's look at the Los Angeles Times, because they do link to that which is at present, yes, a good rebuttal. So the Los Angeles Times says, for somebody who doesn't have the background to dig through a study, it's very hard to know whether it's valid. Says who? Kristen Panthagani, a ER doctor and medical data expert at Yale, who subjected the Florida study to painstaking analysis online. Yes, she did put it in the form of a thread. And she has her own website, and then she put the conclusions in that website, rather than just leaving it on Twitter. This article from the Los Angeles Times makes more observations. It says, in his campaign to succeed Donald Trump as standard bearer of the GOP's far-right wing, DeSantis has positioned himself as perhaps the nation's leading official anti-vaxxer and dispenser of COVID disinformation. The harvest can be measured in dead bodies. Florida's overall death rate from COVID is the 13th worst in the nation. They provide a link. Of course, it's not in the screenshot, but if you visit the article, and I will leave the link for the article in the video description, you're very welcome to investigate that. It compares it with California, because of course this is the LA Times. California, which took its public health responsibilities seriously, ranks 40th. So here's one feedback that came in the news. Another source, the Washington Post, which says democracy dies in darkness. That's their line, their motto. It says, but Latipo's recommendation, extrapolated from a short state analysis that has not been peer-reviewed, carries no authors and warns that its findings are preliminary and should be interpreted with caution, was swiftly condemned by medical and public health leaders who said the Florida Surgeon General's announcement was politics masquerading as science and could lead Americans to forego life-saving interventions. Now, right here, you can see the difference. If you read a tweet in which a statement is made, in which a phrase is used, like the truth, and then the same person a couple of days later, he, of course, has the freedom to change his mind, has gone from saying that he is the one who is speaking the truth or guarding the truth, he's gone to speaking of it as a discussion, and then he goes into conjecture. You can understand that all of that could have been avoided if the language from the very beginning had been more balanced and nuanced. But Twitter as a platform only gives you so many words, and the way you state things in a balanced way does make a difference, even in those limited number of characters that you have. So that's about how you get your knowledge, how you get your information. For people who rely on just Twitter for medical guidance, there is hardly any justification that they should stop there. I've said this many times. Twitter is a place where you can start your investigation. You can start getting acquainted. But that is just the starting point. If a link is left, which the Surgeon General did, and he left a couple of links, that's good. You can look at the study, you can look at the guidance, you can go to the respective website and read the details. How much of it you understand is a different matter, but you have the details there. But if you just stopped right there, the tweet, oh, the Surgeon General said this is the truth. He is the one guarding the truth. And I don't need to look any further. Well, then that is the mistake on the part of those who stopped right there on Twitter. Coming back to this Washington Post article, it says more than a dozen experts interviewed by the Washington Post, including specialists in vaccines, patient safety, and study design, listed concerns with Florida's analysis, saying it relies on information gleaned from frequently inaccurate death certificates rather than medical records, skews the results by trying to exclude anyone with COVID-19 or a COVID-related death, and draws conclusions from a total of 20 cardiac-related deaths in men 18 to 39 that occurred within 4 weeks of vaccination. Experts noted that deaths might have been caused by other factors, including underlying illnesses or undetected COVID. In this one paragraph itself, the Washington Post has done an excellent job of giving you a summary. Again, this is not the end, but it gives you a lot more information than what you could have had on Twitter. Now, do I have other sources that I would like to share with you? Yes, I do. I'm actually looking at a few sources, and let's do this. This is actually not a scripted video. I never make a video with a script. I am doing it spontaneously. So let's do something. Let's look at how Fox News addressed it. Of course, you'll get the link for the article. On your screen would be a screenshot where it says, if we determine a tweet contains misleading or disputed information per our policies, that could lead to harm, we may add a label to the content to provide context and additional information, Twitter stated. And Twitter does that. Let me just stop right here and I'll tell you, on both occasions, if Twitter adds a label, there are people who are conditioned to consider that to be the misinformation, and they consider the one who is labeled to be the source of correct information. Why do they have this viewpoint? It goes back to a fundamental worldview. In their psyche, they are anti-institution, anti-mainstream. Not that these people are not associated with institutions themselves. They very well would be. But they take the view that if Twitter, a platform they use every day, several times, they oppose Twitter. They think Twitter is the evil party. Why? Because Twitter has certain standards. They have certain policies. It doesn't give absolute freedom. And Twitter doesn't have to. No private company has to. If Twitter was a brick and mortar building, they could require of you to wipe your shoes on the doormat before entering the shop. And that would be absolutely justified because you're entering their premises and they have the right to ask you to have your shoes as clean as reasonably possible before entering the shop. And that would be just fine. If they bar you from entering the shop, that too is their right, because that is a private establishment. You could raise a complaint, you could have the matter investigated, but the fact remains that's their premises, their shop, their business, and very much so in the virtual world also. Now, going back to this Fox News article, Carlson asked why other states are not pursuing similar studies. Latipo answered that he sees it as, quote, a reflection of how many things have been so backwards during the pandemic. So he sincerely thinks that. He thinks, I'm assuming he's sincerely saying that in other states they are so backward during the pandemic and in their studies that he is way ahead of them. Or Florida is way ahead of all the rest. From my knowledge, I can say Mr. Latipo is very, very far behind in his understanding, in his knowledge, to be making this remark. And one has to question how well he studies and researches matters himself. Because on one hand, you have the arrogance to say he or I am guarding the truth than to say that other states are backwards. In the age of the internet, where all these journals and articles and peer-reviewed information and direct access to documents from governments and companies is available, and someone is saying that given the information that he shared, that he is ahead and Florida is ahead of the rest, has to be a combination of ignorance and arrogance. And I'll show you more evidence. And there will be evidence that you can consider on your own in the from the links in the video description. He again repeats that statement. I'm coming back to this article. You would never give something to someone who was young and healthy and increase their risk of dying from sudden cardiac death by 84%. But the response is, well, COVID is pretty bad. Yes, COVID can be terrible, but we don't give people medications that kill them. So there's been so much confusion. But yes, that was our finding, and it was a surprise. But that's what the numbers show, he added. So he is part of a group who has done this research. They found we're yet to look at that. What is the critique? And when you look at it, you'll see that when a professional looks at studies, who is in the habit of looking at studies, and we've already come across her name, they can analyze information like the general public can't or won't. And they're not required to. It's the job of experts and professionals to do that sort of analysis. I have a few other screenshots, but since this video is getting to be a bit longer than I had intended, I'm just going to share the screenshots. This one is from MedPage Today. It has that 84% increase highlighted, and the name of the expert from Yale University in New Haven, Connecticut, Kristen Panthagani, MD, PhD, who took a look at this. The link to this article will also be in the video description. And to save time, I have another screenshot, talks about Dr. Latipo, his appointment by Governor Ron DeSantis, the Florida Department of Health. All these are links in that article. And every link, it mentions the Great Barrington Declaration, urgency of normal, roundtable with Governor DeSantis, outright anti-vaxxers like Dr. Robert, inventor of mRNA vaccines, Malone, talking about don't worry, be happy, COVID-19 minimizing. This article, I forget which source I looked at, but when you look at the video description, you will find that I've listed the source. And this is a very link-rich article, so if you want to just go into a very deeper investigation, you could easily do that. But let's come to the work of the expert, Ms. Panthagani. And I looked at that rebuttal. This is on her website. And I'm just going to focus on flaw number 4, which she has highlighted. So see how closely she took a look at this study. I'm going to, let's read. And I'll see, I've already highlighted what I consider to be important. And let's look at this. It says, those who had COVID should be excluded from this analysis, as the protective effect of the vaccine would confound the results. And the authors rightly exclude deaths for which COVID was listed as a cause on death certificate. In the methods, in addition to mentioning the exclusion of people with COVID on their death certificate, they say they excluded people with a documented COVID infection. And then it takes an excerpt from the study under setting and study population, and she has marked out point number 1, had a documented COVID-19 infection. And the part that I have highlighted here is This makes it sound like they had data on who had tested positive for COVID, right? Yes, of course. But later on, they say COVID testing status was unknown. And the only info they had on COVID status was based on the death certificates. And how did she reach that conclusion? Because it says right there in the study. The document, which is not peer-reviewed and, as we have come to know, doesn't have any authors listed on it. Otherwise, you could question them. So, what does the article that she wrote says on her website? So they didn't know whether or not people had COVID unless it was listed on their death certificate. As a side note, this sneaky use of language in the methods section is a red flag. I don't like it. It's a very good article. She did a good, thorough analysis on Twitter and Thread. And then she has put this on her website. And I would recommend just go to the website and read the article. For some reason, just reading it on Twitter, you could do that, is the lesser of the options, or lower quality of the options. Reading it on the website is definitely better, in my view. And I will leave the link for this article. And, of course, when you go to the video description for my video, at the very top you will find a recommendation of a YouTube video that has just been released, just been published. And I watched that entire video. It's by a lady whose channel goes by the name Back to the Science. And she goes through an analysis of the study that was published by the Florida State Health Department. And she gives a critique of that and compares that to another study in the video. I definitely recommend that you watch that video, because that video has nothing to do with politics. It is purely on the science of what we understand. And it has been known for nearly 2 years now that the threat from a SARS-CoV-2 infection, the threat to the heart in terms of myocarditis or pericarditis is much more from the infection than it is from the mRNA vaccines. It has been known, it has been consistently studied, and over and over and over again, this evidence has come out. And it has been known, and the FDA has made an arrangement for it to be reported, that it is a known risk, a very small known risk, that mRNA vaccines produce milder symptoms of myocarditis and pericarditis post-injection, post-vaccination. And it is to be reported to VAERS. And it is all the time being documented, studied, and the evidence has been collected. I made a video earlier about myocarditis, that there's a lot more to it than just COVID-19. There are several causes for myocarditis, and that video will cover that. It covers that. I'll leave a link to that. You'll see it appear at the end of this video. And you can visit that video as well. Now it's coming to almost 30 minutes, and this is what I would like to say. The anti-vaccination movement, from the very beginning, was leaning heavily, more heavily, in terms of its preference towards politics than it did toward science. And the earlier period of confusion when the new vaccines came out was a period of uncertainty, and the anti-vaccination utilized that period to share misinformation, disinformation, And genuinely, there were people who were skeptical. I was one of those who was skeptical. And I found it worthy to look into what they had to say. But consistently, almost 99% of the times, I found that when you look deeper into their claims, whether it's qPCR testing, whether it's vaccines, whether it's vaccine side effects, how they normalize getting infected with SARS-CoV-2 and talk about natural immunity, every single time I have looked deeper into their claims, beyond the statements that are shared on Twitter, I found the details to reveal that they are not telling the truth. I will use those words because sometimes there are outright lies that come from them. And every one of those claims, if you get into investigating them, you lose a lot of time. Had you not been swayed in that direction and just looked at sources who were giving you information transparently, with the details, with nuance, and you could have taken that information and had the opportunity to make a decision. So, I'm going to end this video here. You'll have all the links, and you're welcome to go through other videos that are related to these subjects on my channel. There are quite a few videos. And tell me what you think. I'll post this video to YouTube, and then it will later on automatically appear on Rumble. And I might share this video on Twitter. And once you have the link, you can share the link anywhere, on WhatsApp, through an SMS, through an email, wherever you want to. But this discussion, this commentary, is my unrehearsed commentary as I'm looking at these news articles. I could have done it more thoroughly, but I thought this is the way I want to do it this time. And I am quite pleased with it. Now, if you stayed along for this long, I want to thank you very much for your time. I hope you've benefited from the watching of this video, going through what I went through. And I'll get back to you with another video at another time. I don't know if it'll be on this subject or some other subject. Whatever comes up, I'll address that. So once again, thank you very much for your time. I'll see you later. Goodbye and take care.